everyone. Today I'm going to talk about euthanasia, which is more commonly known as doctor-assisted suicide. This is a pretty deep subject, and before we begin, I wanted to make sure you understand why I chose it. When I was 25, I had late-stage Lyme disease, and it manifested in my body as rheumatoid arthritis. Imagine the worst pain you've ever had in every single joint around the clock, every single day of your life. There is never a moment of comfort, and the pain controls your every waking minute. I was fortunate enough to find a Lyme specialist who helped me manage my pain, and eventually I made a full recovery, but that's not the case with many people who experience chronic pain. Fortunately, I never had a moment where I felt suicidal, but I couldn't imagine living another 50 years in constant agony. So this is an important subject to me because I want people to understand that at some point in their lives, chronic or serious illness will affect them or someone they love. According to the New York Times, the debate around euthanasia really exploded in 1990 because of Dr. Jack Kevorkian, who started a social movement on bioethics and dying with dignity. He opened a medical clinic where his primary function was administering lethal cocktails of drugs to terminally ill patients. This man was a lightning rod for controversy, but, as a journalist for the Detroit Metro Times noted, Jack Kevorkian, faults and all, was a major force of good for this society. He forced us to pay attention to one of the biggest elephants in society's living room. The fact that today vast numbers of people are alive who would rather be dead, who have lives not worth living. It's important to note that the patients who sought out Dr. Kevorkian's help did not have curable diseases and didn't suffer from depression or other psychological illness. These were people dying slow, excruciatingly painful deaths from cancer or other neurodegenerative diseases. An example of the latter is Huntington's disease. The Huntington's Disease Society of America states that after initial onset, most patients live 10 to 20 years. During that time, their healthy brain cells slowly die, causing a myriad of symptoms including lack of coordination, cognition, and inhibition. By the time patients finally die, they are bedridden and nonverbal, and unable even to swallow. If this doesn't fall into the category of a life not worth living, I don't know what does. The major reason Dr. Kevorkian courted the press and public life so boldly was because he wanted to hold physicians responsible for total duty of care to patients, which included end-of-life care. According to Oregon Health Authority, in 1997 the state enacted the first Death with Dignity Act in the United States. Under this law, patients consult with their DDA participating doctors who assess the situation. If all criteria are met, the doctor may prescribe life-ending medication to the patient. They are not allowed to administer it themselves. The 4 criteria are: the patient must be at least 18 years of age, a legal resident of the state, capable of making and communicating healthcare decisions for themselves, and diagnosed with a terminal illness that will lead to death within 6 months. These are all reasonable expectations for both concerned parties, and the law equally protects both the patient and the doctor, ensuring this difficult decision has been well thought out and planned. In order to preserve privacy, dignity, and bodily autonomy, such an important medical decision should only take place between a patient and their physician. According to advocate group Death with Dignity, since 1997, 7 other states and the District of Columbia have passed their own Death with Dignity statutes. Most states are not seriously considering introducing this legislation. It's curious how below the radar this issue seems to be, in light of the fact that our country has a significant number of elderly and sick citizens who could benefit from Death with Dignity laws. To be clear, I'm not arguing that all terminally ill people should choose euthanasia or even consider it. What I'm saying is that those who are considering it and meet the qualifying criteria should have the doctor-assisted suicide option available to them. People deserve the right to choose the time, location, and method of their death. Moreover, they deserve the opportunity to end their suffering and find peace on their own terms. How can we consider ourselves a fair and just society if we can't grant our most vulnerable citizens the chance to die with dignity? Support of euthanasia is increasing among physicians. In 2010, a Medscape survey found that 46% favored doctor-assisted death, which rose to 57% in 2016. This approval rating could be underreported as some doctors are afraid of the public and professional controversy their opinion may cause. According to a Gallup poll taken in 2018, 72% of Americans believe euthanasia should be legal. Most people who are against it believe it's a moral or religious issue, that only God or nature should dictate the time of death. And I think that's fine for those people. It's a totally valid point of view, and they should do whatever is best for them. But in a democracy, all people must have access to all options so that each person can choose what is right for their circumstances. Every state needs to have death with dignity laws on the books so that when the time comes, each citizen can make their own decision. In conclusion, euthanasia is not for everyone, but everyone should have equal access to it.